Okay. So today's topic,
Urinalysis.
Urinalysis, one of Dr. Birch's favorites.
Oh, absolutely.
And we'll go with our objectives. They are to understand the limitations of doing a urinalysis, to recognize disease states are revealed that are not limited to the renal system, and to make a practice of reviewing all aspects of a urinalysis, because I think a lot of people don't only look at key features and miss a lot of things. So.
Yep. And this is, for full disclosure, it's going to be a two-parter.
Isn't that exciting?
So
we'll leave you hanging on this one.
Cliffhanger.
Yep.
We thought we would try to keep it at a reasonable time, and so next week we'll also focus a little bit more on hematuria.
Yep.
Which is a fairly common thing about how do you work it up. So,
right.
And I'm sorry, I ran into Ben this morning. He's on the ICU, and he had a case this morning, and it jogged my memory about a case.
Okay, go ahead.
So even though it's not up there, so the case that I have that involves a urinalysis, this is an old one. So it was back in the day. This man, he's a farmer, and he called in. He's like 49 years old. He's not feeling well. And this is back at a time when we used to do CBCs and all this jazz on everybody. And so his doctor orders up all the jazz, and he gets nothing but he gets a UA, and there's red cells in it, and there's white cells. And
a lot of red cells?
A lot of red cells, and the dipstick's positive. And he gets progressively worse, and he gets treated with many, many rounds of antibiotics, including like 16 shots of Rocephin for this UA that can't seem to grow anything. So that's something to think about.
Yeah.
Anyway, so urinalysis, there's really two big parts. There's a dipstick part and a microscopic part.
And there's limitations to the dipstick primarily.
Yes, and so one of the questions I had was, when do you use the urinalysis for screening? What conditions? You see a lot of them.
We used to do them, it was required to do it annually on every internal medicine. I think this was kind of before guidelines were established.
Yeah.
But you would do a urinalysis every year. And now studies have shown that it's only helpful in
diabetes, pregnancy.
Good.
Diabetes.
And pregnancy.
And pregnancy.
Why in pregnancy?
Like to screen for like UTIs.
Yeah. Because pregnant women, the progesterone, they don't, you need that kind of smooth muscle contraction to move urine along, and so they're more predisposed to getting, and if you have a pregnant woman that has bacteriuria, you should probably treat.
Because it can cause premature labor.
Yep.
So.
Should be examined within 2 hours. And one thing I did get from our article, which, by the way, if there's a resident out there who's extremely motivated, there are not a lot of good urinalysis.
There are no good urinalysis articles.
Exactly.
After reading 3 and barely able to stay awake on them.
Yes, they were bad.
Yeah, they're bad.
I did learn
It'd be a good review article to write.
Yeah, it would be a great opportunity if somebody wanted to write a good review article. A clean catch is as good as a midstream.
Yeah.
So
so you don't have to do all the techniques around the clean catches and everything that is a pretty big burden for the patient.
and one of the
I think we want to say, so if you guys have a urine sample and you see it on the nurse's desk for more than 2 hours and it hasn't been refrigerated, then you probably should recollect the specimen.
It's fraught with error.
Yeah.
Yeah.
So you're going to get misled or miss something for that patient. So refrigerating after the 2 hours is acceptable.
Yes, and one of the other strong odor. The other misleading complaint. I hate this.
Patients always say that.
Yes, I have strong odor, and the ones that I usually get are the ones with the indwelling catheters. And what's the trouble with getting a UA on those people? When should you get a UA on them, and what's the utility of it? So
after you change it?
Yeah, to take out the Foley.
Nah.
Never.
It doesn't matter. You're still going to get junk, right?
Never.
So because what if you get a urine?
Colonized.
Yeah,
because
they got bacteria, right?
You're going to grow something.
Yeah,
and
they're going to grow lots of things.
I have a couple of spinal cord injury patients. One's MS, the other one's a motor vehicle accident. They have suprapubic catheters. These things get infected. And sending a urinalysis, you're going to see what are you expecting to see?
Skin flora.
You're going to see white cells. You might even have some red cells because the bulb that holds it in place bumps around, and you're going to see bacteria. and you will grow significant numbers of colonies.
And lots of resistant stuff that
Yeah.
that isn't your problem.
So the fact that you can grow bacteria doesn't mean there's an infection in that case. The reason to get the culture is because of the resistant patterns. So you treat them only if you're convinced. And I usually go by symptoms.
A lot of patients that have indwelling know it themselves
Mhm.
when they
Yes.
have a UTI. So history's pretty big. This is how it felt when I had my last UTI.
Mhm.
So you have to use other tools. It's not like don't treat, but you have to use your other clinical tools to decide whether you're going to treat.
Yeah, because the last guy had the spinal cord injury patient. We started antibiotics based on he had a white count and he had a fever, which is very helpful. So I said, I think you have an infection. We drew the
White
culture.
count in his blood
A white count in his, I make, because
or
he,
in his urine.
in his serum. I did
In
a
his serum, that's what I
CBC,
mean,
and because he has multiple organisms that are very resistant, and so I picked antibiotic based off the last culture. He called 36 hours into it was still having fevers and rigors, and then the lab called me, and he had bacteremia, and the antibiotic that we had
That'll help
picked,
you.
even though we looked at the last culture carefully, was now resistant.
Yeah.
And so you have to be really careful and judicious. And if they come in, and I have one guy and he fascinates on his urine and he tells me it smells strong all the time, that's not a reason to treat. So you got to be real careful with that. So the dipstick part of the urine is, I think,
Yeah.
what we were going to cover today.
Right.
What things do you get? What is the dipstick part of the urinalysis? Have you guys been to the lab and seen what it is?
It's like
You just
They dip
take
it in the urine.
It's a rainbow.
It's a rainbow.
And then you look at the colors.
It's a colorimetric assay. And what things are on that colorimetric assay?
What does it tell you?
How about pH?
Mm-hmm.
Okay, when's pH helpful?
RTA.
Good job, Ben. If it sits around too long, it's not helpful. I think the thing is to recognize the
A lot of people don't look at the pH.
yeah. But if you have somebody with a metabolic acidosis that you don't understand,
You're right.
and the urine response is inappropriate, that's helpful. But it's so variable, I don't find it terribly helpful. Bilirubin's not one that I look at.
Mm-hmm.
I don't know about you.
I don't find it useful clinically.
What about blood? When can you see blood on a dipstick and there's
no
not actually
RBCs.
blood? Yeah.
No RBCs.
yeah, like myoglobin.
Myoglobinuria, yeah.
Yes.
What else? What if I'm doing a Coombs or something? Why am I doing that?
Would be
Hemolysis.
Hemolysis,
Yes.
right? So you can get hemoglobin without any RBCs as well. So a
Mhm.
lot of people like jump for the myoglobin, but I think your boards and things will be
Mhm.
looking for that too. So
You can see it with strenuous exercise.
yes,
Probably because you dump a little bit, you got a little bit of hemolysis, maybe get some myoglobin, so you can see that with strenuous exercise. And then also don't forget, if it's a female, what do you need to ask?
Menses.
Yeah,
menstruation.
menses
Yeah,
good.
a lot of utility in repeating for blood if nothing else is going
Yes.
on.
Yep.
So repeating it a week later to rule out exercise or menstruation or anything like that.
Leukocyte esterase, what's that tell you guys?
Fiction.
Yeah, infection.
Infection.
Yeah. If it sits around too long, you can get a false positive. What about nitrates?
Gram negative.
Gram negative.
Good.
Yeah, gram negative.
Excellent. Good. Okay, this one actually has come into play recently. Specific gravity. I got a call from the lab. They said, "Oh my, this
There's something
man."
wrong with this
He came
patient.
in and his specific gravity is 1.001.
It's like how
Oh,
concentrated it is.
Yeah,
One
he's
point-
not constant.
yes.
I know, I've just seen it. It's-
1.01. What's
Oh,
this?
that's very
Water.
Yeah, what's
Yes.
by definition the specific gravity of pure water, H2O?
Is one.
His was 1.001 or some very low number. Oh my gosh, what
Why
should we
was he
do?
getting no urine done, Dr. Birch?
He's on a narcotic contract. Does anybody have any other questions for the lab? I had one.
You pour water.
What color was that?
Yeah, exactly.
Well, it was very clear. It was clear, crystal clear. Beautiful urine. It was clear. They
Like
also
spring
they put a
water.
little thing on the side. You probably have one on your fish tank at home, and it measures
Temperature?
Yes, temperature was like 75 degrees. Oh, he's a corpse. He's
But
dead.
don't be fooled.
Yeah, don't be
I've
fooled.
had patients have balloons in body orifices so they could warm up the urine so that the temperature date
Yeah.
was passed. And then I've also had patients that do the same thing, but then actually get their friend's urine to put in there. But funny thing about your friend's urine, if you're a user, they probably aren't very clean
Yes,
either.
you can buy urine on the internet too, apparently.
Is it Amazon?
I don't know. 2-day delivery. It'll probably have some leukocyte esterase though.
Yeah, it will. It's not
It's
refrigerated.
been sitting around. But so in this case, this fellow wasn't that clever, and the temperature was like 75 degrees, so it was essentially tap water. But when would you have?
But he didn't have any narcotics in there.
Yeah, it was still.
Or
he didn't get
marijuana
any.
or
He didn't get a
anything.
renewal either.
That's right.
So what else should you think about if you have a very dilute urine? And I'll tell you the time that I've seen this. It's usually in the hospital. The patient has been in the hospital, and they almost all of them have had sort of some surgery done, and they have an NG in, and they don't have access to free water because they have an ileus or what have you, and their sodium is climbing. Their serum sodium is high. And you look at their urine and you say, wow, they came in and somebody did a urine and the specific gravity is very low. What's
That's not
going on?
right.
And now all of a sudden their serum sodium is high.
Diabetes insipidus.
Yeah, so what's going on with those folks?
Central dose.
It's either central or nephrogenic. Most people with diabetes insipidus, it comes on slowly. And because they have access to free water, they're able to make up by drinking water to keep their serum sodium okay. But these people, it could be a tip-off because they don't usually...
They're NPO.
That's actually been the most common time I've found somebody with DI is they're in for surgery and their access to water is restricted, and you go talk to them, you look back at their urines and you're like, holy cats, your specific gravity has been low for years, and you go talk to them
Yeah.
and they say, yeah, I drink like 6 of those. I go to Buc-ee's and I get this big jar like this and I drink like 6 of them a day, and I
Yeah.
wake up at night and I'm thirsty. So that can be a helpful thing. How about protein?
Diabetes.
So what protein is the dipstick looking for? Now if you look at you take your metabolic panel, right? You're getting a blood draw. You have a total protein measurement and you have albumin. And typically speaking, of all of the protein you have in your body, about half is albumin. So if you wanted to know if there's protein in your urine, remember you have to develop a chemical test. This is a dipstick. You stick it in there, it changes color when the chemicals react. What protein do you want to check for?
No.
Albumin.
Yeah, exactly, because it's half of your protein.
Yeah.
Now-
Because it usually doesn't get filtered
Yeah.
like normal, physiologically.
Exactly. So when would you see
Negative.
a negative? You don't have protein in your urine
By
or
dipstick.
by dipstick, but you do if you do a protein to creatinine ratio.
Globulin.
Yeah.
What's that?
Globulin, maybe?
Yeah.
Immunoglobulins. Yeah.
Yeah.
So what's going on?
Some sort of
Multiple
myeloma.
Yeah,
Yeah.
exactly. And actually, Stephanie and I had a case this week. We had a man that came in with 30-pound weight loss. Creatinine had gone from 1 to 1.5. His hemoglobin was 10. He had lytic bone lesions, and we measured the protein to creatinine ratio in his urine, and it was like 2 or 3 or something. But his dipstick albumin was totally normal. So what's this protein to creatinine ratio? Oh. See, you measure, you can order this, you say, I want the protein concentration, it comes back with, let's say, 6 milligrams per deciliter, creatinine is 2 milligrams per deciliter. So I divide protein by creatinine, milligrams per deciliter, cancels out. Unitless number, what does it tell you?
Because I think there's amount of
It's like
protein
gram.
that
No, sorry.
no, because usually creatinine gets filtered like 100% to the basement membrane, so we are measuring like how much protein is filtered.
It's like grams per day of protein that you're putting
Good,
Yep.
exactly.
And it's pretty
Instead of
accurate.
24 hours.
Yeah,
Instead of 24 hours, which is not worth doing.
yeah. Who knows how to tell a patient to do a 24-hour urine correctly? Okay, what do you tell them?
So they wake up in the morning, they void that one, then they collect everything throughout the day after that. You have to keep it refrigerated, and then the following morning, when they wake up, they collect that one. And they
And
bring
then
it
you have to
in.
run it into the
Yeah.
hospital. That is a pain in the rear end.
Nobody does it.
Nobody does it.
They're at the mall.
Yeah.
They're at McDonald's.
Exactly. You put a
They have to
koozie. You put a
go.
koozie on it to keep it. No. So it's hard to do. So there's the protein to creatinine is a ratio. It's a unitless number, and it's the grams
It really
of
is a
protein
good
in 24 hours. So it's an association. And some smart people found out if you did the 24-hour urine collection, That's what it came up to be.
I do want to mention for some temporary reasons for finding protein in the urine that would, again, kind of like blood, make you want to repeat it. So remember that fever or exercise can make you have protein. And then in young people, they have the orthostatic proteinuria.
Yeah,
So
what's that? Yeah,
That's kind of cool.
I had a case within the last couple of years.
And it's usually young men for some reason.
Life insurance exam.
Mm-hmm.
Guy comes in, they won't give me life insurance. They said I have protein in my urine. I get a protein to creatinine ratio. There's really not much, but there's definitely protein. What's going on? What do you want to do?
How can you repeat it to see if it's accurate or not? Or temporary?
So it sounds like otherwise healthy, right? Kidney function's okay. The protein to creatinine ratio is
Healthy
like
guy.
minimal. He's
Yeah.
like 24, healthy, but no life insurance for you. What you suspect that this is a good story. Orthostatic proteinuria. So
How do you check it?
what's that?
Split urinalysis.
So he needs to have it after he's laying down
Yeah.
for
you
8
tell-
hours.
How do you practically do this?
In the morning.
samples.
Very good. I say when you get up
Laying
from
down for 8 hours, right?
yeah, so you lay them in the clinic. No.
You shut the door and go
You
home.
shut the door, yeah, you check on them intermittently. You have somebody bring them food and water. No, just have them bring, first thing in the morning, they wake up, what's in their bladder has been from when they're recumbent, have them pee in the cup, bring it in. It's a problem with the basement membrane, it's a little thinner, so when you stand up, the extra pressure forces a little protein out. It's a totally benign condition though. Life expectancy, renal failure, all that jazz is all the same as
I
it.
bet you can't convince the life insurance.
You should,
Can
they
you?
are insurable. They should.
They will do it?
They will do it.
Okay.
And you should write the letter and say this patient has, and it, by the way, it tends to run in families. And so you should say this patient has orthostatic proteinuria. It's a totally benign condition. There's absolutely no reason to deny them life insurance, and should be fine. So,
Yep.
but protein to creatinine ratio is super, super important that you understand what it's for. And does it make you think differently? And this is, I thought we'd end here. But if you have a urine, we see lots of urine with white cells and red cells. And what's the first thing that we think about? Infection. Okay. But do you think differently about the urine if it has 3 grams of protein in it and it has red cells and white cells? So that's where I want to leave it, and then I'll tell you more about our case.
I want to mention though
Yes.
that a lot of times you don't know how much, you haven't done the ratio yet. So you see protein with red cells and white cells, and a lot of people mistakenly think, oh, infection, he's going to have some protein in his urine too. And that's not true.
Exactly. Yeah. If you have protein in your urine, you should worry that there's a problem
Check
with
a
it.
ratio
Yes, check a ratio.
quantify it.
Exactly. And
and pick
especially
something else besides infection.
exactly. So white cells and red cells don't just come from an infection; they can come from other itises. So what happened to this guy, the farmer, and we'll pick this up with the microscopic portion next week, is he kept going to this doctor who kept saying the cultures are negative. He gave him, I think, 32 shots of Rocephin in the rear end.
gosh.
He looked like a pincushion.
Wow.
And then he went to another doctor, and the reason he went to the other doctor is he had a new symptom. And the symptom was he had hemoptysis. So that's where we're going to leave it.
I like that.